Hi, I just wanted to share my patient of the day with you, just to give you a bit of insight into, the types of patients that I work with. I just saw this lovely mum who has a 2.5-year-old with constipation. Constipation is very common in little ones. It's very common to present at around 6 months when starting solids. It's very common to present around like toilet training, so sort of between 2 and 3 years of age. But constipation can present at any time, and it can be certainly influenced by many factors. Some of those being fluid intake, overall fluid intake, sometimes fiber intake. But constipation can also be caused by other dietary sources in some situations. And by sources, I don't mean tomato sauce, I mean other food triggers. So to start with, we always look at the general health and fluid intake. So I look at assessing the child's fruit and vegetable intake, their water intake, but then sometimes we need to dig a bit deeper. And this little one was experiencing a lot of gas. And when I assessed her food diary, I also found that she eats a lot of fruit, and some of these fruits were what we call very high fructose or FODMAP. And so this could be playing a role. She also really loved carbs and wheat, so that could be playing a role. But her fluid intake wasn't great either, so that could be playing a role. But then also dairy might be playing a role, because mum had dabbled with removing dairy before, and that had probably helped her constipation. Toileting routine is another factor that we need to look at. So my plan today for this little one was to try a few dietary strategies that I think are going to potentially help her constipation. So I'm giving mum a diet plan which is going to be trialed for the next 4 weeks. And then I also discussed a toileting routine whereby her little one sits on the toilet twice a day, because children need a toileting routine, those that are constipated, especially those that are holding on. And toileting routine is really important to encourage confidence to do a poo on the toilet. And also positioning is crucial. So children need to be seated on the toilet with their feet supported, so that their knees are actually higher than their hips, so that the angle of their knees are not like a right angle, they're actually higher. So it's almost like in a squat position, because that is the best position for the child to be in, or the adult, but for that gastrointestinal tract and the lower part of the gastrointestinal tract to be in, that's the best position to actually properly evacuate the bowel. And so talking about routine and positioning is also really important in the management of pediatric constipation. So there's lots to think about with constipated little ones, aside from just your standard fluid and fiber. It could be dairy, it could be other factors like these FODMAPs that I've talked about with mum today, but also routine and positioning. So that's what we talked about today. I'm going to catch up with her in 4 weeks, and I'm pretty confident that there will be some improvement. Fingers crossed. We've always got a plan B. I've always got things up my sleeve. Actually, the probiotics we're going to stay on too, because she's on a good probiotic and mum thinks that helps too. So that was a little summary of one of my patients today. And I'll try and give you little snippets here and there to give you a bit more insight into my world. Have a great week. See ya.